Today I am going to tell you about heart problems. Now I will show you the normal function of heart. Heart can be divided into two parts, left part and right part. You can see here. And in the left part and right part, and all the blood, the deoxygenated blood, it comes from the body to the right part. You can see the blue deoxygenated blood, and then it goes to lung. And in lung, you can see here, oxygenation takes place, and after oxygenation, pink blood, red blood, it is coming to the left part of the heart, and from there it is pumped to all over the body. This is the normal function of heart. Deoxygenated blood in the right part, and then it goes to lung. From lung it comes to left part of the heart, and from left part of the heart it goes everywhere in the body. Atherosclerosis is a chronic inflammatory response and plaque formation in the wall of arteries due to the accumulation of blood cells, cholesterol and triglyceride. It leads to plaque ruptures, which leads to thrombosis, embolism and narrowing of artery, and therefore an insufficient blood supply to the organ it feeds. This happens all over body, not only in heart, as everybody cares more for heart, because if the heart will stop, person will die. This could be first noticed as erectile dysfunction in many males. Then after investigation, heart problems is noticed. So cardiovascular diseases is the end result of the accumulation of atherosclerotic plaques within the walls of arteries that supplies the muscles of the heart with oxygen and nutrients. By the time that heart problems are detected, the underlying cause, atherosclerosis, is usually quite advanced, having progressed for decades. It's not in 1 or 2 days, it takes long time. The statins form a class of hypolipidemic drugs used to lower cholesterol and prescribed in different name and combinations. Do you know that these cholesterol lowering drugs causes myalgias, muscle cramp, gastrointestinal problems, other symptoms, damaged liver and increased liver enzymes? A clearer major safety concern, myositis, myopathy and rhabdomyolysis occurs. The pathological breakdown of skeletal muscles may lead to acute renal failure. When muscles break down, products damage the kidney. So rhabdomyolysis is very important thing due to cholesterol lowering drugs. In a potential damaging results, a long delayed study showed Merck and the expensive Vytorin that is not beneficial for the artery plaque, which was very popular and people were writing too much of this medication. Vytorin and Zetia are used, sold in United States because of their 200 million they used to spend on advertisement, and it is not useful. Patients with Vytorin actually had more heart attacks, death and heart procedures, and then without taking Vytorin and other cholesterol drugs. Now you can see Vytorin is combined pill of Zetia and Zocor, which generates $5 billion annually for Merck. Doctors recommended AstraZeneca's Crestor, and these cholesterol medicines and other cholesterol medicines, they do body ache, muscle pain, damage in the muscles, skeletal muscles, and because of that damage, it goes to, when the broken muscle constituents, when they go to kidney, they damages kidney, and that is known as rhabdomyolysis, very serious condition, and chronic renal failure takes place with cholesterol lowering drugs. Special natural supplements can save your life. Effective formulations can successfully bring down bad cholesterol to normal level without any side effects. Now I will show about coronary artery disease. This is, you can see here in the heart, there are blood vessels, they supply blood to heart. Heart supplies blood to all over body, but you can see these yellow vessels, they supply blood to heart muscles to function. Now in this vessel, because of high cholesterol, triglyceride, bad cholesterol, LDL, and so much of chemical and our food habit, you can see here in the blood vessel, it is getting deposited. That is known as atherosclerotic patch. And because of this now you can see, in the center there is a black patch. This is because of heart attack. Muscle is damaged because of heart attack. See, right side you can see the normal heart and left side is the abnormal heart. Myocardial infarction or acute myocardial infarction, also known as heart attack, occurs when the blood supply to part of the heart is interrupted as an end result of the accumulation of atherosclerotic plaques within the walls of arteries that supply the muscles of the heart with oxygen and nutrients. The major cause of this is smoking, high cholesterol, bad cholesterol, that is LDL, high homocysteine level. People, they don't know about this thing, very important. A toxic blood amino acid that is elevated when intakes of vitamin B, B2, B6, B12 and folic acid are insufficient or reduced due to many drugs commonly used in diabetes, high blood pressure, obesity and so many other problems. Those medications, they are chemicals, they are not natural. They reduce these things and increases the homocysteine and heart problem ultimately. Do you know or have your doctor ever told you about reperfusion injuries? The absence of oxygen and nutrients from blood creates a condition in which the restoration of circulation results. Because of the blockages or bypass surgery, you recirculate, the circulation is fixed, and because of that inflammation and oxidative damage takes place. Same thing happens in stroke and chronic wound and non-healing ulcers. These are the reasons why after trying and taking your medications by your doctors, you don't get relief, and keep on changing doctors to doctors and hospital to hospitals, but special natural supplements, they can help in these kind of severe situations. Now, the normal heart function is, you can see here, deoxygenated blue blood, it comes in the right part of the heart and then it goes to lung. In lung, the pink oxygenated blood from the lung, it comes to left part of the heart, and from left part of the heart it pumps to all over the body. This is the normal function of the heart. But you can see in the right side, electric pulse makes atria contract first, and then the electric pulse goes to the lower side in the left side, and now electric pulse contracts the ventricle. So this is the normal function of the heart, and this is what happens. Blue oxygenated blood comes to the lung, and then pink oxygenated blood goes from the ventricle to all over the body. But in heart failure, the valve and heart muscles, they both can involve, or one thing can cause problems. Due to the heart attack, contraction reduces, and you can see in the left corner that there is a black area. Because of heart attack, that muscle is damaged, and because of its pumping capacity increases, low pumping is done by the heart, and always blood is remaining there, and they cannot perform, they cannot walk, people. And because of this problem, now you can see in the lung, both sides, there is fluid deposition is taking place, and because of fluid deposition, the pulmonary hypertension takes place, and patients, people, they cannot do their daily routine, their performances. The heart enlarges, natural supplements, they can improve a lot in these things.